Alhamdulillah wassalatu wassalamu ala rasulillah. My distinguished ladies and gentlemen, good day to you all. Today we are going to talk about pelvic inflammatory disease, which is PID. When we talk about pelvic inflammatory disease, PID is a general term that we use to describe infection that affect the female reproductive organ, including uterus, fallopian tube, and ovaries. So the main cause of pelvic inflammatory disease are sexually transmitted infection like gonorrhea, chlamydia, and so on. The signs and symptoms of pelvic inflammatory disease are similar to those of pelvic sexually transmitted infection, which include unusual vaginal discharge, heavy or painful menstruation, painful sexual intercourse, painful urination, pelvic pain, and so on. The risk factors of pelvic inflammatory disease include: number one, having multiple sexual partner, or having a partner that has multiple sexual partner, history of sexually transmitted infection, inappropriate conducting of some certain diagnostic investigation like during insertion of intrauterine devices, and so on. So these are the potential risk factors of developing pelvic inflammatory disease. So what are the tests that you are expected to carry out when you have a pelvic inflammatory disease? These tests include urinalysis, swab tests, ultrasound, pelvic examination, and so on. So the complication of pelvic inflammatory disease include infertility, ectopic pregnancy, frequent or chronic pelvic pain. So these are some complications of pelvic inflammatory disease. Thank you. My name is Al-Mustapha.